Good morning, friends. Myself, Dr. Jnaneshwari, specialist internal medicine, coming from NMC My Salon. Uh, I hope all of you know your BMI. Have you checked? Yes? Have you checked your BMI? I hope you are aware, hence, the session will be useful for all of you. Today, I am talking about the most common health problem which we are facing today in the world, which is totally preventable and reversible. So, what is it? Can you take a guess? It's obesity. Obesity, obesity induced health problems, the complications, the prevention, I will be talking today about, okay? Health and obesity today is the topic. The objectives of this session: definition of health, definition of body mass index, what is obesity, and to know health consequences of obesity, to learn about strategies to reduce obesity and promote health. So, World Health Organization defines health as a state of complete physical, mental, social well-being and not merely the absence of disease or infirmity. The physical component of health is measured by the term called body mass index. The rest of the components which I told you in the definition, the social, mental, will not be included in this body mass index, but yet these factors also affect your overweight and obesity. This also contributes up to 50% for your net effect of overweight and obesity. So, coming to the definition of body mass index, what is it? It is a simple index of weight for height that is commonly used to classify overweight, obesity, and also underweight. So, by weight in kg, by height in meter square, we get an ideal body mass index. Where there are few exceptions for this. For example, we don't consider BMI in cases of pregnant when they are a very good muscular body, pregnant and infants, and also children. This is basically for adult population, BMI. So it is also further classified to underweight and overweight. The normal range of BMI is 18.5 to 24.9, below which is underweight, above which is overweight. Overweight is further classified into pre-obese, obese class 1, 2, 3. Pre-obese is 25 to 29.9. Class 1 of obesity people fall in 30 to 34.9. Class 2 obesity 35 to 39.9, and anything above 40 is morbid obesity. So friends, please check your BMI today and please be aware where you stand today. So coming to the definition, what is obesity? It is not just being fat, or it is not just because your father and mother was fat and just because you had a genetic history of being fat that you are fat. There is no such terminology today. For your height, is the weight matching? That is all which matters. So the definition of obesity. It is defined as abnormal or excessive fat accumulation that presents as a risk to health. So if you ask me, I don't eat anything fat like fatty foods, but still I am obese. Remember friends, whatever you eat today that is in excess will be converted to fat and stored in your body. This is the only form which is as stored in the body for further use of the calories. So as I was telling you, it is the most common preventable and reversible cause disorder as of today. So coming to the statistics, worldwide, the burden of obesity today, the worldwide prevalence of obesity has nearly tripled from 1975 to 2016, of which in 2016 statistics, it is seen that adults aged 18 years and over were overweight, about 39%, of which 39% were men and 40% were women. And of 13% of world population were obese in 2016 statistics, where 13% were obese, in which 11% were men and 15% were women. The risk of women getting obesity is more, because usually after the post menopause time, the hormonal influence is very much hampered in the fat metabolism, especially the estrogen, which becomes deficient, that predisposes you to get obese. Most of the world's population live in countries where overweight and obesity is killing more people than underweight. Initially, it was underweight which used to kill people. Even now, in certain countries like Africa and all, underweight is killing. But here, now the trend is like the overweight and obesity has taken a upper hand. So you should be knowing what are the causes. It is basic imbalance between the calorie that you are consuming and the calorie that you are expending. If there is a mismatch, then for sure there you are setting in the obesity. An increase in physical inactivity, changing modes of transportation, increasing urbanization have known to be the causes of obesity. So what affects obesity? I mean to say, what causes obesity? The socioeconomic status, the environmental factors, physical inactivity, sedentary life, dietary trends, and mostly in cases of childhood obesity, genetic and antenatal factors play a vital role. If the mother had a genetic history of diabetes in the pregnancy, then the child will have obesity in the before 12 years. So what obesity results in, you should be knowing. There is a varied clinical manifestation of obesity. The most common what we come across is insulin resistance type of type 2 diabetes mellitus, hormonal problems like polycystic ovarian disease, increased blood pressure leading to cardiovascular disease, sleep and lung disorder leading to obstructive and sleep apnea, that is breathing problem and sleep problem. That is, most of you who are obese here would have felt that you are snoring a lot, associated with your wife or anybody complaining that why are you snoring so much, and some jerky movements in the sleep and such things, which is called as obstructive sleep apnea, and psychosocial problems. So the complications which may result in obesity, varying from stroke, heart disease, diabetes because of insulin resistant, pancreatitis, arthritis can be because of increased uric acid, sleep apnea as what I already told you, lung problems, liver disease in the form of fatty liver, gallstones and cancer. Now these are the varied components of obesity. There is a metabolic component, psychological, financial and mechanical components in obesity. Most commonly what we encounter in the pre-obese stage is the metabolic. The first diagram says there gout. Gout means increased uric acid levels that will result in further accumulation of the uric acid crystals in the joints and cause pain in the lower limb joints, smaller joints, swelling and such things. Second, fatty liver. Fatty liver is accumulation of the excess fat in your liver that results in the enlargement of the liver. Most of them, more than 75% of fatty liver is asymptomatic. Hypertriglyceridemia is increased cholesterol levels in the blood. Diabetes mellitus because of the insulin resistance. Increased blood pressure leading to hypertension, and fertility issues also are very common with obesity and cancer. Second most important component is the mechanical problems because of obesity. One, their sleep is not sound. Second, osteoarthritis. Because of the overweight, their knees are susceptible for arthritis. Early primary osteoarthritis. Thirdly is the incontinence associated can be with fecal incontinence or urinary incontinence, and also the gastric reflux. Because of the lax gastroesophageal sphincter, there is reflux of the acid. Because of the abdominal obesity, the stomach capacity will be reduced, where the acid will keep refluxing, and whatever little you eat, you feel like as if you're going on getting it out, the burping and the increased burning sensation and early fullness of abdomen, such factors. Now coming to the psychological factors. Yes, this is of course the most important thing what we have coming across in the clinical practice. They are not confident, they have low esteem, especially the one who come with obesity class 2 and class 3. They have some eating disorders where they are unable to control their urge to eat. When they feel they have to eat, they cannot control. They are depressed most of the time, and sleeping disorder, I told you they are not having a good sound sleep. Financial problems they get is because of the income, disabilities because of the joint problems, insurance, and employment is also the upcoming problem because of obesity. So if you are obese and today also you are courageous and confident that, oh, nothing will happen for 5 years, I am fine, I am bearing a weight of 90, 100, I am all fine. This is your misconception. There is a golden time that God gives us to change, say 5 to 10 years. After that, therein the end organ damages start in this crucial hour when you don't correct and get back to your normal weight. So what are those risks that you are at risk to face? That is dementia. What is dementia? A loss of memory. 30% of obese are known to have dementia. Heart failure because of increased blood pressure, increased cholesterol, and 50% patients definitely have a diabetes because of the insulin resistance. 200% risk of multiple sclerosis, that is because of the weakness of the nerves. Demyelination of the nerves results in multiple sclerosis, giving to back pain, weakness in the limbs, rashes, such problems. 25% patients of obesity are depressed, and 33% are known to have asthma problem even if they had no genetic predisposition. So what is metabolic syndrome? Metabolic syndrome is a component, is a syndrome in which 4 main components are there. Today if I have to tell you, okay, you are at a risk of getting diabetes in the next coming 3 to 5 years, you will have to know that is these 4 components applicable to you or no. What are those 4 components? 1, your abdominal girth. If you are a woman, your abdominal girth, if above 80, 1 factor. If you are a man, 90 to 100. If it is above, there you are satisfying 1 risk factor for a metabolic syndrome. Second is the increased triglyceride level. Third, increased sugar level. Fourth, increased blood pressure. As a consequence of these 4 component impairment, you will end up with these complications of heart disease, lipid problems, hypertension, diabetes, dementia, as I told you, loss of memory, cancer, polycystic ovarian disease, and the fatty liver problem. Obesity today is fueling in the rise of type 2 diabetes. 50% patients of diabetes today don't have a genetic history. It is all because of lifestyle modification. If you mind today, I bet in 5 to 10 years the risk will come down not only for us and also for our children and for the next generation. Today we change, it is better for the future and for the upcoming generation. If the present trend continues, 1 in 3 people will be obese by the year 2034, of which 1 in 10 will develop type 2 diabetes mellitus. So this you should be knowing, cancers that is associated with overweight and obesity. The one related to brain matter, it is called meningioma, thyroid gland cancers, breast cancers, usually breast cancers in the postmenopausal after the period stop, liver dysfunctions, fatty liver not treated for long days, for long years can result in liver malignancies, gallbladder cancers, upper stomach, that is the food pipe, the lower end of the esophagus, that is the adenocarcinoma, which is most common, pancreas carcinomas, colon and rectum, ovaries, endometrium, renal, multiple myeloma, that is because of the blood cell variation. The platelets will be low in most of the obese patients. That is again because of the depression of the bone marrow for producing platelets. So coming to the most important part of obesity, how to prevent it. This, as I told you, this is the only preventable and completely reversible problem. Even today it is still possible. It is all about what we eat. It is aham annam. What we eat is what we suffer. So when you are in front of your plate, you should know what is the consequence of your whatever you are eating today. You may feel, okay, one day nothing will happen. It's not that I've been eating this for years. Everything that you eat will count. That is very important. Disciplined eating, very important. Limit your intake from fats and sugars. If you are eating more, then work it out and then only go to bed. Don't think tomorrow I'll do walking and today you'll eat KFC. It will not work. Tomorrow's calories will be again added, then you have to do 2 days job and work out. So better limit and eat as what is necessary. Increase your consumption of fruits and vegetables, whole grains and nuts, that is very important. For an adult, 45 minutes of minimum physical activity in the form of walking, running, whatever. I ideally don't recommend gym. Walking is better. If you cannot walk, you can do some isotonic physical exercises at home. 45 minutes, 5 days a week is more than enough according to the present guidelines if you strictly follow. And for a kid, for a children, it is 1 hour per day. That is very important. Now coming to the ideal meal plan. So what does this ideal meal plan signify? So in a plate of your food, 50% of your food should constitute protein. In this, what is that is protein? Chapati is a protein, the meat is a protein, dal is a protein. So 50% protein. Coming to the carbohydrate, that is 20%, that is rice. Vitamins and minerals are the vegetables, salads and curd, and the 10% oil you get with the sweet or the curd and oil. Now coming to the fruits and the buttermilk, all that you can take as a complement. And remember, what is a balanced diet chart? It is not that most of the patients I see now, they are telling I am following keto diet and I lost 10 kgs and I lost 12 kgs like that in 1 to 3 months and they are so happy. Keto diet, for the transient change, you will pay rest of your life. What is happening in keto diet today? The change which this diet is bringing in is very transient. And after you leave that diet, you are gaining back the double of cholesterol, the double of sugar and the double nutrients which was not available. Remember friends, eating rice won't cause diabetes. 20% of your diet should have carbohydrates. Forget about me, what I am telling. What about our great grandparents? What did they eat? Did they go do keto diet or did they eat all that protein rich food and all? No, it was just that balanced diet which mattered so much for them. The vegetable, fruit, curd, little rice, dal when you are not taking a meat. If you're taking a meat, avoid dal and chapatis. This is the most important component of the lunch and dinner. 50% of your food consumption should be taken in the morning of the days, 30% in the afternoon and 20% in the night. Only 20% of the food consumption of the day should be taken in the night. Otherwise, you are at a very, very high risk of obesity. Always have a very good breakfast in the morning. If you risk your life to run your vehicle without a breakfast, it is like running your vehicle without a fuel in the morning. That again will cause other problems because of fasting, excessive fasting, and then you'll come back and eat 3 to 4 times more than what you would have eaten if you would have not skipped the breakfast. Okay? This is about the ideal meal plan. Eating at regular intervals with adequate spacing between meals. Avoid overeating, binge eating. Take lots of vegetables and salads. At least 400 grams of fruits. Fruits have a very good antioxidants which will reduce your blood pressure, reduce your weight, reduce your risk for diabetes. Fruits is a vital component. Okay, and you know all the junk food should be avoided, all the sweets, direct sweets, sugars, processed foods. Why processed food? Artificial flavored drinks. All this, one, they are adulterated, there are preservatives, there are extra amounts of salt, extra amount of sugar, that all that will be a burden for your fatty liver if you are already obese. So this is a very important thing. Adding on is alcohol and smoking, which will worsen your life further. Okay friends, today if we take care of our weight, then we can help our next generation to prevent childhood obesity. Can you just see the statistics? 41 million children under the age of 5, at 5 years they are overweight or obese in the recent statistics in 2016. And over 340 million children in the age of 5 and 19 are overweight and obese. All this is because of the junk food. Eating well, watching TV, not having any physical activity, no outdoor games. All of us here are experts. We have come here for a purpose. We are just concentrating on money, wealth and not health. If you don't have a good health, what will you do with this money? You'll go back home and spend all this for yourself and for your kids and nothing else. Introducing healthy eating habits in early childhood. Today you take a plate of food as how I designed. Your kids will follow this tomorrow because you are the best teacher for your kids. Avoid all this for your kids, sweets, chocolates, junk, and encourage them to play outdoor in the favorable climate for 1 hour every day, which is very important. First of all, you be a role model and then set an example. So now, coming to the evolution of man, see, this is what we knew. We developed like this. So now, this is what we have feared because of the urbanization. We are all having sedentary lifestyle, loss of physical activity. We have become like this. Next, because of obesity, this is what we will be in future accepting. We have no other go. If you are obese today, tomorrow you will need a special kinds of like special chairs, special commode and special dressing and special everything. And that is not only to satisfy you, but it will make you mentally very unstable. Your work capacity will come down, your concentration will come down, your memory will be affected. Lot of things will be affected with obesity. So the final say is eat healthy, sleep adequately, exercise regularly. These are the 3 important things, please, that you have to follow to have a healthy life and to be happy. Thank you one and all for your patient hearing.